Hello everybody, welcome to the second episode of Unchained. I'm here with my friend Biresaw today. He's truly one of the most amazing people I've met in my entire life. I can also call him one of my best friends, so yes, it's a great listen. He's from Ethiopia, which if you don't know, it's to the north of Kenya. It's to the west of Somalia and Djibouti. It borders Eritrea and Sudan as well. An interesting thing is it was never colonized by a Western nation. It had a little kerfuffle with Italy back in the day, but no colonization, and so their government sort of moves toward this Marxist type approach, which is also interesting because usually African nations will move towards something like socialism after these events, but Ethiopia did not. I know Ethiopia from the 80s and Live Aid and the big famine that happened, but then the movement towards the documentation of the famine, getting to Western television and making the "We Are the World, We Are the People" one of the biggest aid movements of all time, really. So if we can kind of connect our brains to those pictures, and this is actually the Ethiopia we're talking about, it's no different, it's the same country. So yes, we should really care about these things. So another interesting thing is then there was some ethnic turmoil, and Eritrea split from Ethiopia in 1993. Now, that may sound kind of normal, but it actually made Ethiopia landlocked then. And so they now have to rent a port from Djibouti to have access to the ocean. So this is just very interesting geographical things. So let's move on to the episode. Ethiopia is so cool because they have great dance, music, everything. I could talk about it for a long time. But anyway, Biresaw is an epidemiologist, but he really specializes in gender-based violence and sexual violence and intimate partner violence, as well as mental health. So very, very interesting topics for today, but a little disclaimer, it is quite sensitive. So at the end, we kind of circle back around to mindset. What can we do about these issues? How can we think about them in a way that is productive? How can we change systems to make these things better? Conflict, violence, sexual assault, all these things are very, very on the forefront of lots of African nations, any nation really. We start off with a conversation about data. This is very interesting. He's an epidemiologist, right? Lots of projects in these different countries take data backing up. Why is it so important that we need to do this? What are the numbers? Where are we going? Where are we at? You'll hear him talk about all this. Another disclaimer, I fell off my scooter that day, so I have a big road rash on my elbow. Try not to get distracted by it. And the video cuts out for a little bit, but it comes back in, it's okay. So enjoy.
Data is everything, and without data you can't do anything.
Yes.
Your base, your standpoint is data.
We should talk about this. We can go into the introductions later, and I'll splice it. But like, why do you think that's so important? Because actually, this is super interesting.
Yeah.
Why do you think getting data is so important? Because I think that's a missing piece of a lot of people's project, is like your basis of your whole idea needs to be supported by like a bunch of data. And you're an epidemiologist.
Yeah. Because if you do not know your start, you cannot decide your journey, your endpoint, your destination. So data tells that. It uses to plan, to forecast, to measure, to evaluate everything.
Yeah.
So data is very important.
Okay.
Data is very important for everything to begin. Without data, even a simple market can't be done without data.
Yes. Yeah.
When you come to health, data is very important. Everything is made based on data, based on conclusions. Even some things can be made with single case studies or case scenarios, but majority of public health programs, public health interventions, public health medicines, anything is done based on large data sets.
Yeah.
Because population is there's a variety of population, different characteristics, different nature. So you need to get the mean based on a large data. Unless it's very difficult.
Unless the data isn't there. Or like in Ethiopia, how do you get how do you get data? Like, is Ethiopia pretty good at gathering its public health data through their systems, or like in America, we have all the hospitals have some kind of Epic, or they run off of some kind of healthcare database that stores everything.
Yeah, I don't think so. In Ethiopia, actually, data utilization starts in the near future.
Okay.
So as to have a good understanding of a problem or something, you need to have large data, a long period of data.
Longitudinal data, yeah, lots of longitudinal.
That gives a clear, just a clear point about what you want. When I learned epidemiology, there were at least 5 projects which is based on data. So you need to collect a 5-year data to evaluate a program, some programs effectiveness. So with a single period of within a single year data, you can't decide, you can't conclude, you can't predict it is nature, it is progress. Everything is very difficult. For example, a malaria outbreak can be happen every 10 years. So in order to
every 10 years?
every 10 years or like that. So if you don't have a data, a long period of data, you can't respond, you can't prepare programs, you can't adjust the interventions accordingly. So when you see the developed countries, they have data more than 100 years of data.
Yes.
That's very important for forecasting. They can forecast based on the data for next 30 years, 50 years, like that. In case of developing countries that have no too much data, short data is very difficult. To design a program to forecast what will happen in the nature based on analyzing of important parameters that is to forecast, to predict public health problems, public health challenges in the future. Even
is Ethiopia getting there? Are they getting there as far as this data collection and stuff? Like, are you guys able to kind of predict some things? Like, or are you getting better every year, or are you still a far way away from?
If you get your idea,
is that a good question?
The national system has established the data collection system, DHIS2 system. I don't know when it starts.
Okay.
So it uses DHIS2. It collects data from every health facility from DHIS2 systems.
Okay.
So based on that, the national health Minister of Health plans, executes, implements program based on that data.
Based on that data.
But that data has very limitations in terms of training person, skilled part, in terms of infrastructure, computers, internet, in terms of quality of data. So it's not enough to give good decisions on programs for even decision makers. That's a limitation.
Okay. So yeah. Okay. So you might do these studies and stuff, but then the data is not quality enough for the minister to be like, yes, let's make a change.
Yeah. For special cases, for example, for epidemic malaria is a big problem in Ethiopia. So the malaria program collects program-specific malaria-specific info data, so as to collect quality of data to implement effective strategies, intervention strategies for malaria program. So in such cases, a special program, a special data collection, a special data collection systems designed like malaria and other HIV and other diseases like that. So this also depends on some funds a fund availability. It's not
Okay.
not sustainable.
Yeah.
If the fund cuts, they will stop
It just
automatically.
stops. Yeah, yeah.
So when you come to data, it needs to establish a sustainable and
Okay.
resilient system that captures data at any point, at any challenge,
Any
at,
challenge,
at
any
any
point,
situation.
any
Yeah,
situation.
and that data will be used for effective action.
Gotcha. Yeah.
Action.
Makes sense. Makes total sense. Oh, I don't want to get into budget cuts and stuff, but is some of those budgets coming from USAID or in the Trump administration, or you don't know? We don't have to. We don't have to talk about it.
Actually, yeah, different programs, different donors like US, WHO,
Yeah,
like
WHO.
UN, and other funds from other funds and from other interested NGOs.
Okay.
The fund may be available and based on
But it's
program interest.
Program interest. It's unpredictable. Like
Yeah.
you never know what's gonna
Yeah.
be good, get funds or not get funds. Yeah, that's data is so important. But I'm like this, like you know, I don't think it's underrated. This is such a good conversation. Yeah. I didn't know we were gonna start there, but that was a good conversation. Thanks, Beer. Because Beer, I'm gonna flatter you a little bit. You are so inspiring and like warm, and you're like one of my favorite people here. Wait, am I allowed to say that on the podcast? Because we have such good conversations in the mornings. Just you, me, and Djibril. We just have a good morning every morning, and I feel happy and stuff like that. So I really wanted to share that with the world. Yeah.
Really, I feel like that also. My behavior is a little bit just I'm not too fast, I'm not too slow.
Yeah.
Just I want to understand the situation, the people's.
Okay.
So my is my approach is based on that. So as your approach, as I understand your approach, your style, that's good for me. Communicate, to understand, to talk.
Oh yeah, okay. Because you learn more. Same here. Yeah, same here with you. Yeah.
That's my behavior.
Okay, gotcha.
I want to learn more. I want to know new things from every person.
And was this like, so you're from Ethiopia. Sometimes I have to go back because the viewers don't know anything about you. So you're from Ethiopia, you're an epidemiologist. Now you're here on this fellowship. But then let's go back to what you just said. Like what motivates you to learn more about people? Is that normal? Do you think that's normal? Or like I don't think it's normal. Like you always wanting to question and learn. Where does that come from? Where does that mindset come from for you?
Yeah, just my motivation. My motivation comes from everything. When I see good persons with success, with effort, just that person motivates me.
Okay.
And if I saw something that's very inspireful for me, it motivates me.
Okay.
But when it comes to my country specific, just I came from a rural area.
Okay.
A rural area, and there is no school, health, road access. Yes, I learned from very far working through foods, walks, and my parents carried my parents' intention to educate me without having education on them. It opens a very good opportunity for me to learn, to know more about. So after, if my parents without education educates me, teaches me, knowing the importance of education, so I need to. I will be I will be more than my families, for my next generation, for my child, for my sons, because I need to create a good environment, better than me, because my families create better opportunities for me.
Yeah. Okay.
So I need to create a better opportunity for my generation.
Kids. Yeah, and for the next generation.
The other thing is, in my area there was no school. Still there's many challenges, and I want to work, especially in health area. I want to do something important, especially in public health awareness, public health programs.
Awareness, yes.
That benefits the community as a whole, because many children, many uh, communities lose their child, their wives, their relatives with simple uh, illness. So
Or
if
conflict, or is it
yeah,
part or conflict too?
yeah, that's a big issue.
Yeah, that's a big issue.
Very good. The
Hold on,
conflict,
I think
the conflict is very big. The program, the another intention, the another inspiring. Uh, what other situation inspires me is when I join after joining Amhara Public Health Institute, which is my another enabling environment, working environment for me, especially.
Okay.
It's made me better
Okay.
than before. So the I situation I exposed in the Amhara Public Health Institute is that the staff delivery is coordinating those stakeholders from the community, from the government sectors, from the UN sectors, NGOs, civil societies, and religious actors. So coordinating these, these, we can do more about, because how can I coordinate that? There is a technical working group. Technical working group means technically working organizations and actors meet together, and just I present the problems that in the community, and every actors in the meeting takes their responsibility to act accordingly. For example, they can do collectively. We can plan a single plan, and there is no duplication of efforts. They can do according to the plan, shared plan. Yeah. Shared plan. So as a team lead, I was coordinating the UN organizations, WHO, UNICEF, UNFPA, like that. The universities around that, the government sectors like women affairs, education, police, legal system, health system, religious leaders, and community leaders. So when you present the real problem, they understand and they take home assignment. What's my responsibility? They ask themselves. So based on that, we plan.
You plan
based on the problem in the planning. Then we share the responsibilities for these technical groups. And they do like that.
Okay. But the goal is, if I'm understanding correctly, like, is this the goal of your project eventually? Is like, let's say you have a sexual assault victim, they can go somewhere and they can get a physical checkup, a mental health checkup, they can get social services, they can get what else? Social service like food stamps and shelter, but also physical and mental health all in one.
In this section, we are coordinating mental health and sexual and gender-based violence programs. So when we come to sexual and gender-based violences, the survivors need health care. Survivors need legal service. The survivors need shelter. The survivors need social support. So survivors need mental health care. So what we do in this case, the actors collected in the technical working group, we establish one-stop centers. One-stop centers means a center established at health facilities, especially at hospitals, containing health professional, police, justice, social affairs, social work, mental health specialist, and shelter for the survivor. So the survivor,
That's a better word than
the survivor means just affected by violence, or so she gets that service at one point because affected person searching for these services along with sectors is
it's
very
a mess. Yeah, it's hard and it's a mess.
So that's why I'm doing right now a software just totally because we established very few one-stop centers like that, around 17 one-stop centers. So in the region is very large and more than 1,000 health facilities.
Okay.
So only around 17 one-stop centers. So the conflict is throughout the region, and it needs such kind of system everywhere. As the conflict continues, there is sexual and gender-based violence. So it needs to provide comprehensive service for survivors.
Comprehensive.
So if just I'm trying to solve digitally that because you cannot address the whole region on such way.
Like you can't have a physical. You can't have a physical place that has a police station, a lawyer, a doctor, social services. So you're trying to make like a data an online thing, a software thing that connects everybody together, right? Or that they can go to one. I'm just curious. Yeah, like they can go to one place and get all those services, but they don't necessarily have to be physical people there. It's like one person is maybe helping the survivor get connected to all these things in one place, right?
That's why I'm working right now. Is that why?
Okay.
That's why. I know the problem and it needs a solution for that. Just I'm consulting some professional because the program is interdisciplinary and intersectoral.
Yes. Okay.
So it may consult from the police side, from the justice side, from the social work side. I'm working a software that connects the survivor from the beginning to get information what is there for what's the service available for survivors. The one thing that it includes the software. The other thing is the referral package.
The referral. Okay.
If the survivor gets one sector, then automatically based on her need, she can connect with other sectors.
Okay.
That's what I'm working now. That's what
you're working on. Is that why you're learning Python?
Yeah, really.
Dude, really. You're so great.
I want to implement this. I know the problem.
You know, yeah,
because
by
said the GBB is very sensitive. It's very sensitive, and even the door of the action wants to hide the information, wants to tag the information. Because in one side, the software helps to handle the information properly. The other thing, it enables the survivor to connect without hardship to the
without
services.
hardship. Yeah. So I was like, okay, maybe we lost a little bit of video. That's okay. But anyway, we are at such a good point. Because she has a the survivor, has a stigma of actually getting help because it's awful.
Yeah.
Like it's an awful thing to ask for help for. I mean, I know a lot of people who it's happened to who don't say anything until it's really bothering them, until they really run into problems later in their life. Yeah. So within your app or whatever, is it an app or like, is this interface, like, how does it make it easy for them to use? Like, is it all confidential? Like, is it confidential? Like for example, so if they're in the house and they don't want anybody to know that they're trying to get these services, I'm sure it's quite confidential or like.
Really, yeah. So mostly persons or people survivors seek service from health or police. Only the global data says that 6% of survivors seek services.
6%.
6%. This is global data. Yeah.
Oh, global data. Okay,
Yeah.
okay.
Because of
I
this
mean,
the stigma.
I'm not
and
that surprised actually, but
stigma
yeah, the
and
stigma.
they hold by themselves.
Right,
Unless
right,
they
right.
need critical health issues or other critical things, they don't want to go to health services or other services.
Right.
They won't. Especially in the awareness is very in poor awareness setups is very difficult.
Okay, okay.
So the one thing that the software is to provide information, because most of survivors didn't know the services available after the occasion, after the problem happened.
They have no idea what to do.
Yeah. So maybe it's difficult for those illiterate, but those who can read and write can track information. What are the available services for a person getting such kind of accidents, and they know the information. It has information, survivor information that gives information about the health service, about the legal service, about social service, about everything. The one thing they can get with their mobile application, what are the available. The other thing, there are free tolls, toll-free information to get further information.
Okay, okay.
And that's very important to create awareness and to understand what the risks and the risks and the benefits, what they may face if after the accident. The one thing is that regarding the confidentiality, is very confidential, end-to-end encryption.
Okay.
Even without her consent.
Oh, hello. Oh, yeah, okay.
Without consent, even no referral is proceed. So even referral from health center, from health service to other sector is based on her consent.
Okay.
That's the software is based on that.
And
based on the information shared to other sector is based on her consent and based on her intent.
Okay.
So it's very secure, multilingual, and end-to-end encryption. That's the software, and you can store data for program.
Oh yeah, I could store data while it's at it. Yeah.
That's the best thing.
Okay.
So it's very important. I think it's very important for survivors and for programmers or for those who want to understand the impact, and this is very important.
And even like making it or like isn't intimate partner violence like a huge thing also?
Intimate partner violence is very common.
It's but across everywhere. Again, everywhere. But it's just sometimes on this podcast we don't get to talk about all the issues, and I want to talk about all the issues, like because I just learned this when I was here, and you can tell me what you think of this interpretation. But we had that lecture the other day. Those students from the University of Washington, I think they were from, and they came. That one girl was working on intimate partner violence. Okay. And then the G-Brain was showing me a website. I'll post the website in the link because everybody should check it out. It blew my mind, like how much intimate partner violence is in Africa. I mean, it's everywhere, but like particularly Africa, like Nigeria was really bad, but also there's a lot of data because it's a big country and that kind of thing. But like, I didn't learn about that in school. So now I'm like, oh, this is crazy. Yeah.
Intimate partner violence is the most prevalent types of violence throughout the world, and especially in developing countries. But the worst scenario comes during conflict because there is no legal system, there is no social system, no social networks break at all, and it changes to the worst and the very tragic state. So yeah, there is parent. The most what can I say? The most fatal consequence of violence is suicide, because uh, after survivors commit suicide.
Right.
Yeah. I have a case scenario that when during visiting some facilities, I got two females admitted with such chemical poisoning, intentional chemical poisoning, and they're taking chemical for just harming themselves.
To try to kill themselves, yeah.
So I was interviewing them. What's happened? What the problem? How does the problem really happen to you? The problem was sexual violence. Sexual violence. So I asked them, yeah, they were abused, sexually violated with someone. The one who knows like intimate, the other one is with strange.
Stranger.
Yeah.
Okay.
So the very bad things that I understand at that facility. How do you feel now of surviving because you are taking medicine now? You are not died. You are survived due to health service. Are you happy? I asked her. No, I'm not happy.
Yeah.
Because you see, the impact is very severe. Mentally, psychological impact. We can address psychological impact, also psychological consequences with to the health vector. So it's very common during conflict. Is very severe, especially people is living in a crowded condition like.
Like
Now,
a refugee camp or
people is
some kind of
displaced and living in a very crowded condition. It's common in so
That's
so very
yeah.
very difficult and
Very
worse
difficult. Yeah.
situation. I know situation in the last 4 years in my country. The burdens and the scenarios what I see is very tragic.
Very tragic. Yeah, that's so awful. Ugh.
What can I change is that we can track data based on data. At least we are doing something, some program interventions, because there is a problem. Due to the problem, it needs solution. It needs intervention.
Sure. Yeah.
What kind of intervention? Just we see suicide, we see unwanted pregnancy, we see abortion, we see many things as a consequence. We see other STI and other diseases. So programs need to address such things. Even if we can, even it's difficult to stop. Actually, the data itself is important for the prevention aspect as well. As well. Because when you show this for policymakers, for decision makers, they can design a preventive strategy,
right?
Legal strategies, other strategies,
and then
based on that.
Based off of that, yeah.
So at least we are doing life-saving activities. As a health professional, our responsibility is just after the accident, we provide drugs for PEP, post-exposure prophylaxis, STI treatment, emergency contraceptive, like emergency care and others. These are life-saving and critical, very important things for survivors.
Damn,
and we can connect and then we can
good.
connect for social supports, those organizations and other sectors, so as to give life skill trainings and cash supports so as to support the survivors.
Okay. That kind of talked about mindset a little bit already, but like every day, how do you stay so positive through all of these things? Is that a bad question?
No, it's bad.
Okay.
Yeah, I think every day when I wake up healthy, just I assume that is another chance for me. Just another opportunity, another good thing for me. Just I start like that because every new day is a new day that can't see before. So it's an opportunity.
And it's a new opportunity.
Yes, that makes positive for me.
Yes.
And I act like that.
That makes me so happy. I'm very similar. Or like, we talk about this, but yeah, that just idea you have in your head just like calms your whole nervous system of like every day is a new day. It could be positive. Yeah, it could be good. Could be great. You go for your run in the morning. You go for your 6 a.m. run.
Yeah, really.
Then you do your works. And then you do your gym.
Yeah.
And then you hang out outside.
Like that. Yeah. In the morning, just I pray and I run. I do exercises. I take shower. Then I go for work until my mind works. Then like that. Just I'm happy. Just I want to do like that. Because I'm here due to previous some efforts. So I need to use my effort.
Make the best of it. Yeah. And you're so resilient and smart. Yeah.
Thank you very much.
Yeah, it's true. It's true. No, like you say, who motivates you? I have the same thing. You are one of the people that motivates me because I see how hard you work, and you're like,
you are really motivates me.
Oh,
it's really.
We motivate each other.
You are so strong. You are committed.
Oh, thanks.
And you are consistent.
Oh, yeah, consistent. Yeah, consistent. But you're also consistent. Like I think that's sometimes those little efforts just every day over a long time will add up more than cramming 3 days and like not sleeping for 3 days, but then you had a month to do something, But for me, the consistency makes me grounded because there's this saying that I really like. This podcast, his name is Rich Roll. I'll send it to you. Okay. He says mood follows action. Yeah. Mood follows action.
Really? I proved it.
Okay.
Yeah.
Okay, so you agree. Yeah. Mood follows action. Yeah. Good stuff here.
It makes sense.
Okay.
Because making people happy gives more happy for you rather than the people's you. There is some proverb, not remember the exact word, that just making people happy gives more happiness for the doer than the receiver.
The receiver, yeah.
Just you are like that. You are thinking like that, and that's very good.
Okay, it's interesting. Yeah. Just for the receiver, or like.
Because when you do something, when you do important for, I think people may be happy, feel happy. Seeing that happiness due to as the cause for you makes more happy you. It gives happiness for you.
You think so? Yeah.
I think like.
Yeah, I think it does, but it shouldn't be the reason why you do something. Yeah. Like it of course it makes me happier, or it gives a sense of accomplishment, or dare I say satisfaction. Satisfaction is a crazy word, but like, it shouldn't be the reason why you do something. Okay. Like to make yourself happy, like helping someone else to make yourself happy isn't the reason. The reason is just to do something good. That's just the reason.
Yeah.
That's just like your ego. Your ego. That's what I'm getting at. My ego. Like I have a big ego. Okay. You know ego. You know what ego means?
I know ego.
Yeah, ego. Oh yes, you do. Yeah. Sorry. Yeah. Sometimes I talk too fast, and I'm like, and then. Like so, it's like
ego is sometimes very bad, sometimes good.
Oh yeah, okay. When is
understand
it good?
That.
When is it good? When is ego good? Oh yeah, this is so interesting. Is it good? Is ego good sometimes?
Sometimes maybe like it gives like energy.
Okay.
I think, but sometimes I'm breaking. What kind of ego? Just I can't express this because ego is sometimes very dangerous.
Yeah.
Uh, it loses perspectives. It hides a person's perspective when one when one is with super ego, just he can't see another perspectives, the perspectives fully.
Okay, yes.
Because his ego covers everything what happened. That's
right.
Oh.
But then if you don't have an ego,
I don't know the way how understand the term ego. Just as ego, sometimes ego when, for example, can say that the Ethiopians, for example, the Ethiopians think that we are warriors and we are not colonized and we cannot break by anything.
Yeah, you guys are like Ethiopia.
Yeah, that's big ego. Just this ego by itself, without doing nothing, without it's very dangerous.
Interesting. Yes, I get it. Yeah,
just like that.
yeah. Okay.
In one part is energy. Yeah, we can do. We have strengths. We can do everything. That's the good part.
You still have to have that's the good part. Yes.
Holding that only the.
But then expecting that you'll have everything, like
without doing, without fighting, without.
Yes.
Very dangerous.
Interesting. That is very dangerous. Interesting. Wow, fascinating. I get so. Yeah, because that's almost like the underdog mentality. You know the underdog mentality, like when you're, like, for example, let's say that your baseball team, okay, your football team, you guys don't play much baseball. Your soccer team, your football team,
okay,
you're the worst football team in the league. Okay, let's say you're the worst football team in the league, and there's the best football league in the team, and you play at the end of the season. Okay, so you know you're the worst team, so you're working real hard because you're trying to get better and better and better. So you train every day because you're the worst and you got to get better. And you know you're underdog, so you have to train really, really hard and work really, really hard. And then the team that's really, really good, they're like, oh, I'm good already. Like, I don't need to work that hard. Who's going to win the match? I actually don't know, but like, who's going to win? The team that worked really, really hard because they knew they were bad at the beginning, or the team that didn't work hard because they were naturally good.
Oh, that work is hard because the ego, the one breaks the ego. We are very good and they are not working well.
Yeah,
that's my saying.
Yeah. Interesting. But then, so
actually ego is the ability that you tell that you can, but you need to do.
But you need to do.
Yeah.
Yeah.
You cannot say that.
Fascinating. But you still need to do the thing.
Yeah.
Yeah, you can't let it. There has to be some kind of balance.
Yeah.
Of like thinking you can.
You know you can do.
You know you can do it, but then you have to do it. Like, I can do this, but I gotta get there to do it. Yeah.
That's right.
Wow, Bire, you're the best. This is so interesting. Yeah, it's so interesting. And then, like, my dad, for example, like, or like, never thinking you have. This is what I don't know if it's good or bad, but like, even though I grew up very secure. You know, we had enough money, we were fine. You know, did my mom let me buy organic carrots because they were more expensive? No, she's always going to buy cheaper carrots because they're going to be cheaper. But the point is, my dad is like, works so hard. My mom works so hard. They both never stop working hard. Even though we have enough to live, it's never enough. And I don't know if this is a good thing or a bad thing, but I think this is an American mentality. This is probably a world mentality. but like never having enough. So I need to work to get more, to get more, to get more. But like, when is it just okay? Like, when is it just fine? You know?
Yeah, they're right. I think they are right.
Okay.
Because they need to work.
They need to work, yeah. And then they're retiring soon, I think anyway. My dad will probably never retire. But even when he's retired, like he will work. He will work on the house, he'll build some sheds, he'll build some this, he'll build some that, which is cool. I think it's good, but like I wonder, like, when are we ever satisfied in the world? Like, and that's when we come back to like kind of like, are we ever happy with what we have? And I think that circles back to what we were saying earlier about how your mentality, my mentality, they're similar. We wake up every day and we're like, it's a good day. It's a good day. And that's where the happiness comes from. It's not getting more money, getting more of this, getting more of that. It's a daily, it's not super happy, it's not super low, it's just okay.
Really.
Yeah. Do you have anything else you want to say on this podcast, or have any other things?
What can I say? Just, thank you very much for just asking. Just you are asking just what I want to talk. It's my feeling. I'm so happy for that.
Oh, sweet. Okay, so
I'm so happy.
We did some good topics, or we talked about some good topics, or
okay,
sweet.
really.
Okay.
We touched very good topics.
Sweet.
Anyways, Razan, you are very you are model for me. I learned many things within this short period of time with you.
Oh, sweet.
And just it's good.
Oh, thanks. Yeah, thanks. Yeah.
Coding.
Yeah.
Because I can't make everything as you want.
No.
Because it needs guidance. It needs.
Oh.